This talk is about what is a hip replacement. It's a very common and very smart question. A hip replacement is a simulation of what our own hip is like. It actually is consistent of 4 different components, 2 on the socket side and 2 on the femur side, which is your thigh bone. So this is what we call a half a pelvis. This is the front, and towards me is the back. This is the femur, which is your thigh bone, and the socket is right here. I'm going to try to take this apart and just show you what that really means. This is the pelvis, and the socket is right there. And the socket, it looks like a half a hemisphere. The original one is not exactly like that, but intraoperatively in surgery, we use a certain machining that is a half a circle that maybe it's about 1 millimeter smaller than the actual implant. So that allows us to do a press fit into the socket. So our bone is actually a bit flexible, so it can expand a bit, and it provides stability for the implant. But also the manufacturer will allow us to have a screw fixation. So some patients will look at their x-ray and say, wow, well, in my right side, I don't have screws, but the left side, I do. And that has to do with the feeling intraoperatively. If it's 100% very stable and no question about the stability, no screws are needed in my practice. In some that I don't have 100%, then I will add the screws to them. The inside of the socket will be lined with a plastic liner, and that plastic liner will act as the cushion. So these are the 2 pieces for the socket. If I take the femur itself, so the femur originally will have the ball right here and the neck. So we will cut the neck in the half mark on there and machine the inside of the femur to match the cross section of this component, as you can see, so that it fits right into it as a nice fit. This part will have a ball that is modular. That ball allows me for different sizes of the ball, but also it allows me to adjust minor fine-tuning as far as the length is concerned, and that will fit on top of the femur. These 2 together do not connect with a mechanical connection. What actually controls the ball to fit into the socket is your muscle that comes from the pelvis and attaches to the femur from all around, the back, the front, and the sides. And the tension of that muscle is the one that keeps the ball into the socket.